Hi, welcome back to Rohrich Knows Podcast, helping you become a better you. Often we talk about supplements. Certainly in my practice, I give all my patients preoperative and postoperative supplements. And so they always ask me, well, what supplements do you take? And I say, I take a lot of the supplements that I recommend you take. In fact, I take almost all of them and a few more. So let's go through some of what I call life supplements. There are 8 essentials, and then there are others, and based upon the level of evidence that I think is important. And of course, before we talk about any supplements, as you know, a diet probably is the most important thing of all. And all these things for age prevention or reversal. It's, using sunscreens, don't smoke, science-based skin care, meditation, stress reduction, probably the biggest thing, get the crazies out of your life, low caloric diet, exercise and training, and then of course, ultimately, if all that doesn't prevail, you can do facial surgery, aesthetic facial surgery. And these things are all very helpful. But, for longevity, I try to practice now, trying to get more sleep. Many times, many of you who know me know that I don't sleep that much, but stress reduction is very important, intermittent fasting, positive thinking, keeping the crazies at bay, minimizing dairy, yoga, muscle strengthening. All these things are very, very important. The other thing is having a focused, purpose-driven life. As I mentioned, removing those life suckers, avoiding overthinking, overworrying, live for today. And then live your dreams, not somebody else's, and worry less. These are all things I try and practice every day. It's hard to do, but really, it really makes a huge difference. So I'm going to talk about, in this part, about what I call lifestyle supplements. 8 that I think are high-level evidence supplements, and then in part 2, I'll talk about the lower-level evidence supplements that are also 8 or more. And I'm just going to divide them up into these types. That means high level of scientific evidence. And what are they? Well, they're vitamin C, probiotics, omega-3 fish oil, zinc, vitamin D3, magnesium, collagen, and creatine. Those are the things I'll talk about. So are these all the essentials? Well, these are the essentials that I take every day, beginning with vitamin C. And I think that that's very, very important. Now, vitamin C, you take 1 or 2 grams a day. It's essential for collagen production. It's an antioxidant. It's been used for many, many times. It improves your hydration of your skin and sometimes even reduces your wrinkles. Of course, there's a great natural resource of vitamin C, in fruits and all kinds of berries, Brussels sprouts, but I take at least 2 grams a day, especially if I want to support my immune system. And that's very powerful. And if you feel yourself kind of getting a cold coming on, I double that dose. So probiotics are also very important because your gut rules your life. So probiotics are live microorganisms that that have potential health benefits. They improve your gut microflora. And I think that's so important because our microflora in our gut is probably what rules the day for us. So they support your gut health, your immune function. And, you can take these, I take a couple of them in the morning and in the afternoon, and there's a 1 to 10 billion CFUs daily. That sounds like an incredible amount. It depends on the strain, but I think taking daily probiotics is very important. And of course, you can get them naturally as well. The probiotics, are in yogurt and kombucha and kefir, and then the prebiotics are also important and probably as important, and that's in onions and tomatoes and bananas. But I think the key thing to consider is, their potency, their shelf life, and then I think the capsule form is much better absorbed. And then omega-3 fish oil, about 1,000 grams a day, but you got to be careful to not do too much. It's an anti-inflammatory. It's key for the brain and the eyes, heart health, unless you take too much. Brain health, joint health, those are all very important. The big thing is, I don't think you should take too much, and it's EPA and DHA. Now, these are very important. The amount that you take of each should be 1-to-1. But I would say there's been a recent study to show that if you take more than 100 milligrams a day, there's a higher risk of atrial fibrillation, especially in an older age group. So don't overdo it. That's very important. Don't overdo it. You know, omega-3s are very important because, you know, they help reduce triglycerides, help lower your blood pressure, and they're very cardioprotective unless you overdo it. So the real thing here is what is the difference between, you know, EHA and DHA? And I would say that both are very powerful, but if you're choosing one, you should choose one that has, you know, the DHA is more likely to be beneficial to support your brain health. And the EPA is more beneficial if you want to have cardiovascular support. So I would say get a balance of both. And I think that it's very important to understand that you should have a balance of both the DHA and the EPA. And I think that they both have an inflammatory effect, but that the EPA is actually more powerful in boosting brain health. So what ratio should you have? It depends on what you're aiming for. And of course, natural sources of those are salmon, mackerel, herring, all those things. But I think the key is to try and have a ratio of 1-to-1 of DHA to EPA. In general, I think is probably a very safe way to go. And then take no more than 1,000 milligrams per day. And like I said, because there's recent studies to show that it may increase your risk of atrial fibrillation later in life. Now, zinc is a very powerful supplement because it's a trace element. It's essential for so many things in our body. So the key is, you know, don't take too much. 30 to 40 milligrams of elemental is good per day. It improves your immunity, your eyes, your heart, your skin health, and it supports immune function. So, and obviously, it's very important to make sure you take this, especially if you're getting sick. I think taking zinc is a very powerful modulator because it's a really important immunoprotective part of your body. And it also helps with wound healing and your sense of taste and smell. And of course, the dietary sources include chicken, red meat, and fortified breakfast cereals. But believe me, breakfast cereals have so many bad things. I wouldn't usually take any breakfast cereals. So which type should you take? You know, there's so many. I like the bisglycinate and the piconate. I don't like the citrate or the acetate because I think that the resorption is not as good as the piconate and the bisglycinate. That's just my preference. So another powerful essential element is vitamin D3, 5,000 units per day. Even if you live in Texas, I remember about 2 years ago, I got a blood panel, and the only thing I was low in was in vitamin D. And I said, well, God, I live in Texas. Well, doesn't mean anything. So vitamin D3 is better than D2. You know, D3 is derived from, it's actually produced in the human body, and it's found in animal foods. So most of the time, you should take vitamin D. It's more active and more effective than D2. So remember that. And it supports bone health, immune function. So take, you know, minimum of 5,000 units a day. If you're getting sick, I double that for about a week. So that's the recommended dose. And magnesium is also a very powerful supplement because it helps with so many bodily functions, over 300 in your body. And it can help prevent muscle cramps, improve memory, and cognitive, your cognition. I think that's very, very important. It also helps you sleep at night, so take it at night. And so don't take more than 400 milligrams per day. And I usually take this supplement at night. All the others I take in the morning. So take this at night. I like magnesium malate. I think it's highly absorbable. And I think that's also crosses the blood-brain barrier. Magnesium glycinate is also very good. And I think you just choose it so that it matches what you want to accomplish. There's many different types of magnesium. So what about collagen versus whey protein? This has been going on forever. Now, is collagen truly helpful? And the studies recently have shown that it is. And I must say I'm a recent convert because collagen is a structural protein. It's a supplement that can, support healthy skin and address aging signs. So I think it's actually a very important emerging supplement. It's good as a powder, and to take it every day is very, very important, for healthy skin. Now, when you take collagen versus whey protein, collagen's for healthy skin, whey protein's for muscle mass buildup, and I think those are the differences. So if you're really going to be pumping iron and using muscle, want to build up your muscle mass, use whey protein. So I think that's the differentiator. I personally prefer collagen because it helps protein. It helps you with your healthy skin and joint support, and that's just my thoughts. And then perhaps the king of the supplements for muscle mass maintenance, especially if you're anybody over 50, is creatine. Now, again, I'm a recent convert because it truly is the undisputed king of sports nutrition supplements, and it's very safe. It's been clinically proven to be not only a muscle maintenance and performer, but also for enhancement of your performance, especially if you work out and you want to maintain your muscle mass and grow it. So it's been well studied as a supplement. It includes its efficacy and safety in both healthy athletes and the aging population. So I think this is something that's been a misnomer. And now, calcium is I think, an outlier, because I think you should take calcium if it's prescribed by your physician, especially, and be careful, you shouldn't take vitamin D at the same time as you take the calcium supplement. And it is important for bone health and maintaining a cardiovascular system, but don't overdo it. This is just like overdoing fish oil. Because if you increase your supplement, you can increase your risk of colon polyps in the intestine and kidney stones. So don't overdo it. You shouldn't really take more than 1,000 milligrams per day if you're over age 50, much like the fish oils. Very important. And dietary calcium is safe, but just be careful and don't overdo calcium supplements. So I put this in the category of have this be guided by your physician. So, in summary, these are the 8 essential summary supplements that I use every day. They're important in your diet. Of course, you can get most of them from your diet, but the key is use them wisely. Don't overdose them. They're not a substitute for proper diet and proper eating. They can and will boost your immune system. And always keep yourself updated on what's current in the supplement literature, especially, the increased risk of overdosing with fish oil and atrial fibrillation, and then, of course, overdosing with calcium and kidney stones and colon polyps. So know before you go. Hopefully this was helpful to you as it's been to me as I've been evolving my use of supplements throughout my life. Give me your comments and thoughts, and till next time, helping you become a better and more educated you.